My name is Michael Wenders. I have been a urologist at the urology clinic Wiener Platz in Munich since 2015, and before that, I worked in Berlin. So urology is my specialty. It is important to realize that there is no single correct treatment for benign prostatic hyperplasia. The choice of therapy is always individual. It takes into account the patient's age, concomitant diseases, and most importantly, the degree of enlargement of the prostate. Therefore, there is no single treatment option that is optimal for every patient. Doctors always use a personalized treatment regimen. The most common methods we use in our clinic are classic TURP and other types of resection performed with ablative techniques. These are the treatment options that we most often recommend to our patients, but the choice of one of them always depends on individual needs. Rezum water vapor therapy is an excellent treatment option, but it is not suitable for everyone. Treatment with the Rezum method is primarily indicated for elderly patients with a high risk of bleeding or an underlying disease that makes traditional surgery contraindicated, as well as for young men for whom it is important to maintain erection and normal urination. Another important condition for Rezum therapy is that the prostate should only be slightly enlarged. Such a treatment also requires an individual approach, so the possibility of using this method must be discussed individually with the patient. And I repeat once again that the Rezum procedure is not indicated for everyone. There is also a risk of swelling of the prostate gland and the development of an inflammatory reaction due to exposure to water vapor when Rezum therapy is used. For some time, the patient may have a low urine output and may not even need to place a urinary catheter. Just because Rezum therapy is a relatively simple treatment and can be completed in one day, does not mean that the patient will have no problems later and will not need time to recover after the treatment. In most cases, the Rezum procedure allows to avoid retrograde ejaculation, but it is impossible to guarantee the absence of this complication. Occasionally men have this problem after Rezum therapy, so these points should be discussed with the patient. In principle, however, Rezum therapy is a reliable method that has proven its effectiveness. My colleagues are often faced with the choice between ablative treatments or classical resection. This choice also depends on how often a colleague has one or the other procedure performed. If the prostate gland is significantly enlarged, I always recommend treatment with the above-mentioned methods, and our partners perform the appropriate intervention. The most important thing before starting treatment is to decide on an individualized regimen and to understand which option is best for the patient. I think it is also very important for the patient to understand how the treatment planning process works. Patients must first undergo diagnostics and then have an individual consultation with the physician, during which the specialist will prescribe a personalized treatment regimen. Of course, there are cases where a patient only wants one type of treatment and not the other, but this is not necessarily the best treatment option. That is why it is always very important to discuss all the nuances with the patient in advance and to perform preliminary diagnostic tests. There are also cases where the patient wants a specific type of treatment and has ruled out other options, but in reality, most patients are pragmatic people. They are easily convinced that the treatment option they thought was ideal for them may not be so good. They are willing to try the proposed treatment option that will give them better results. Of course, if the patient has firmly decided to undergo this or that treatment and it has no absolute contraindications or does not pose a threat to their health, they will undergo it. This approach to treatment usually produces results, but whether that result is best for the patient should be discussed on an individual basis. First of all, in such situations, we would like to recommend that patients send a request in advance, describing their clinical case and clarifying important questions, so that there are no disappointments later. Sometimes one or two facts in the information provided by the patient are enough to determine that a particular method is not suitable for them. For example, the patient has a pacemaker, his blood is too thin, or his prostate is extremely enlarged. There are always facts that make it clear from the beginning whether or not a particular procedure can be performed. It is also important that the patient has a clear idea of the treatment options available in his case. A visit to the clinic will then definitely yield results.
Do you perform outpatient surgery in your clinic? For which indications or diagnoses is this possible? What kind of patients do you treat on an outpatient basis?
Our clinic performs minor surgical procedures, such as circumcision and vasectomy, on an outpatient basis. These are classical operations for a urology clinic. We always perform them under local anesthesia rather than general anesthesia. Our clinic also performs outpatient cystoscopy and diagnostic procedures such as urodynamic testing.
If the patient is scheduled for an invasive procedure or surgery, where will it be performed? Where do you refer to these patients?
I personally operate on patients at the ISAR hospital. The most frequent referrals are to the ISAR hospital or the University Hospital Rechts der ISAR, but in principle, our patients are operated on at all the hospitals in Munich.